Hi, and welcome to our debate discussion today regarding ABA and school-wide positive behavior intervention and supports. My name is Jennifer Howe, and today I'm going to serve as the introducer and the organizer for our group presentation. Beginning in the 1960s, we had lots of work from B.F. Skinner and operant learning. ABA is based on many of those principles, and it was further outlined by Bear, Wolf, and Risley what the 7 dimensions of ABA are. In response to some utilization of aversive techniques and in response to the disability movement in the 1980s, school-wide positive behavior supports became more prominent in our schools and has continued to expand over the years. In our discussion today, we're going to discuss school-wide positive behavior supports, and that will begin today with a discussion from our group member named Ashley Kachersky. I'd like to make sure that we first introduce all group members before we begin. The first speaker for us today is Ashley Kachersky. We also will have EJ and Sweeney, who will be discussing ABA. Kelsey will be serving as our question fielder and as one of our information consultants in this video. In addition, we have Megan Pawson, who is our researcher, and Zachary Caruso, who is responsible for the illustrations that are within our presentation. With that being said, we'll go ahead and begin today by hearing from Ashley Kachersky regarding school-wide positive behavior supports.
SWPBIS, what is it? School-wide positive behavior support is a broad-based prevention approach to supporting a student's behavior. SWPBS takes elements from applied behavior analysis, such as contextual validity, systems change, inclusive ethics, and stakeholder participation. It believes that all students need support, whether it be preventative or in the form of behavior management. The overall goal is to provide an environment where students can be included, learn to their best abilities, and learn pro-social behaviors before maladaptive behaviors develop. It not only guides students to make better choices, but also teaches them help-seeking behaviors for when they do need assistance. For example, if a student is having trouble attending to desk work, SWPBS may reinforce positive behaviors such as sitting quietly and working with verbal praise. Then reference to pro-social behaviors such as, hey, if you want a break, you could just ask. For students who need more concrete assistance, a break card may be implemented or routine breaks every so often to prevent problem behaviors. Using this approach, the problem behavior pathway is avoided or in best cases never formed. What are the levels of SWPBIS? As previously mentioned, SWPBS assumes that all students require classroom support. The way SWPBS approaches helping all students is by using their 3-tier model. In this model, the first tier is universal to all students and how instruction is taught to all students. The primary focus in this tier is proactive strategies such as copying good tickets and positive verbal praise from teachers. The second tier is focused on students who do not respond to tier 1. These students are placed in small groups, usually 3 to 4 students, and receive instruction that is catered to helping with their behaviors. Lastly, tier 3 provides more intensive approaches such as individualized one-on-one behavior therapy or instruction specific to the student. The 3 tiers are meant to be fluid, meaning a student can go from the tiers as often as needed with the goal to be included in tier 1 as much as possible.
Now we are going to be looking at a visual that's going to be provided by Zachary Caruso. Zachary, if you'd like to go ahead and share that information with us.
Sure. So here we have a visual depiction of what SWPBIS looks like. As Ashley was discussing before, it's divided up into a 3-tier system. I think it's important to note that the different percentages of students who fall into each tier. In that first tier, 80 to 90% of students fall into that. And then students who that tier doesn't work for will go into the secondary tier, which comes out to 5 to 10% of the population. And then only 1 to 5% of the population need to go into that final tier, which is the most intensive.
What about students with severe disabilities? Students with severe disabilities and severe behavior problems can still benefit from SWPBS. In fact, in 2004, the Individuals with Disabilities Education Act, IDEA, recognized the success of SWPBS and required it for all students requiring special education services. As mentioned before, the tiers are meant to be fluid, meaning a student is not limited to one tier and can freely move between the tiers as needed. This means if a student is having a really bad day, he or she may be in Tier 1 for the majority of the day, and the next day, depending on performance, may be moved back to Tier 1. The same is with students with severe disabilities. Someone who requires a lot of support may spend the majority of his or her time in Tier 3 rather than Tier 1 and 2. Outcomes of SWPBIS. SWPBIS has the potential to have many positive outcomes for students, stakeholders, and teachers. It has the potential to positively affect school reforms, making it more inclusive for students with disabilities by providing the framework needed to maintain and support inclusive practices, creating an inclusive vision and leadership, team comprised of teachers and stakeholders, and support personnel such as ABA therapists, investing in resources for individual supports. This means government funding, providing well-trained staff, meaning teachers who are trained in the principles, and also other ABA professionals who can help teachers with training and support. Creating systems to guide teams through problem solving and data-based decisions. So this means the implementation is always evidence-based. Lastly, it empowers teachers, thereby fostering student success across all students.
Okay, so here we have one particular school's SWPBIS program. So as you can tell, it gives a visual representation for both staff and students to follow. It has written guidelines in there that illustrates what the school's expectations are, so everyone knows how to follow it.
Overall, SWPBIS is a component of ABA, making it loosely connected. SWPBIS is derived from ABA, similar to how pivotal response training is a technique derived from ABA. It focuses more on proactive interventions rather than management of problem behavior. The focus is placed on inclusion, especially in the school setting. So we want to keep kids in Tier 1 as much as possible. We want to keep them included in their activities. SWPBIS and ABA have the same goals and values. Some of the goals that they share are respect for the individual, meaningful outcomes, social validation, dignity, normalization, inclusion, person-centered planning, and self-determination and stakeholder participation. I want to put emphasis on normalization and inclusion. A really big goal of SWPBIS is including students in their natural environment, and ABA, one of the main goals is making their lives as normal as possible and including them in as many everyday activities as possible. SWPBIS and ABA use the same approaches and tools to solve problems. Some of these tools include lifestyle change, functional analysis, multi-component interventions, manipulation, teaching adaptive behaviors, building effective environments, the decreased use of punishers, social validation, and distinguishing between emergency and proactive strategies.
ABA and SWPBIS are loosely connected. Todd Risley, a prominent founder of ABA, and is also a prominent co-founder of PBS. His description of lifestyle arrangements is one of the seminal articles defining the essential elements of PBIS. PBS is viewed as an opportunity to build upon the ABA tradition by incorporating concepts and strategies from a variety of sources to address issues and problems whose resolution would further enhance our pragmatic impact on society. As stated by Johnston, along with other authors, several leaders of PBIS were trained in behavior analysis, and its literature has notable similarities to the ABA literature. Also discussed by Dunlap, Carr, Horner, Zarcone, and Swartz, that it is not surprising that a large portion of the principal contributors to PBS were trained as behavior analysis, published research, and served on the editorial boards of ABA journals, in journals such as Journal of Applied Behavior Analysis, and remain committed to and identified with ABA. Carr, in 2002, identified ABA as the essential foundation and source from which PBS practices have emerged, and acknowledged, in particular, the apparent conceptual framework in the assessment and intervention technologies that stem from ABA as core components of PBS. Dunlap's article also stated that the conceptual foundation of ABA is Skinner's framework of instructional or also apparent learning. This framework also forms a significant part of the conceptual basis of PBS. Thus, principles of reinforcement, contingency management, stimulus control, shaping, fading, prompting, functional equivalence, and generalization and maintenance are fundamental to PBS and ABA. PBS is exploring additional concepts that may prove useful in improving community-based outcomes, such as contextual fit, the role of relationships in intervention planning and implementation, increased reliance on social validity, and systems variables that relate to replication and sustainability. Its conceptual core comes from the same source as that of ABA. Similar to ABA, PBS is an empirical approach that relies on valid and reliable data to support its practices. Research and practices in both areas are routinely peer-reviewed and published in numerous highly regarded journals, such as 686 behavior modification journals. Similarly, federal funding for research studies have provided following peer review of grant proposals in both PBS and ABA-based research. Both findings are empirically derived from practices to implement assessment and intervention strategies that are used based on high-quality research. The technology of ABA involves reinforcement and contingency management, prompting, functional assessment, and functional analysis, shaping and fading, and manipulations of stimulus control, and establishing operations. For example, PBS in schools provides visual prompting every day. Schools post visual aids by posting signs and posters throughout the schools to serve as a visual prompt of what they should and how they should be behaving while in the community within the school. Being derived from ABA, these general procedural categories also serve as the foundation of PBS interventions. Given that these strategies come from the basic laws of behavioral science, this concordance is not all surprising. The basic technology of behavior change has not been created with the emergence of PBS, and it is clear that PBS practice continues to be defined to a great extent by procedures developed and validated by ABA. PBS and ABA share a foundation, focus on positive reinforcement instead of punishment. Both collect data to ensure that what they are doing is effective, and most importantly, they both have the well-being of the individual in mind. Each may be implemented in their own way, but overall, ABA and PBIS are loosely connected.
Key components of ABA practice. These will look familiar. I will discuss the 7 dimensions as outlined by Bear, Wolf, and Risley. These are applied, behavioral, analytic, technological, conceptual systems, effective, and generality. Other key components would be evidence-based practices, service providers, governing body, range of application, multiple teaching techniques, multiple skill areas, manipulation of environment, and reinforcement-based.
All right, we actually have an incoming question. How would you explain and relate Bear, Wolf, and Risley 1968 definition of characteristics of ABA as applied, behavioral, analytic, technological, systematic, effective, and having generality to SWPBIS.
In reference to the 7 dimensions of ABA, the first, applied, is addressing socially significant behavior. Behavior is not chosen out of convenience, but rather out of significance. SWPBIS addresses and applies socially significant behaviors, but lacks the specificity of ABA. The second dimension, behavioral, focuses on observable and measurable behavior. This not only is in reference to the client, but also for the provider. Does the data criteria change based on the length of time the observer collects it? Behavioral dimension in SWPBIS is satisfied by utilizing and changing observable and measurable behaviors. Analytic. This is the demonstration of control over the behavior. Control over the behavior is crucial. This could be achieved with strategies such as data collection, reversal designs, or multiple baselines. The analytic characteristics of ABA are not apparent within SWPBIS. Oftentimes, data collection is lax in comparison with ABA. There's a shortage of trained staff and specialists within schools who can address the analytic dimension. Technological. Practices are clearly stated, thoroughly explained, and easily replicated. Sufficient description and explanation for replication is contained. Precise replication hinges on professional and appropriate terms and explanations regarding procedures. SWPBIS lacks an element of technicality. There are not operational definitions of expected behaviors, which creates a looser environment and interpretations of behaviors. PBS does not utilize a specific manner through which interventions are implemented. Conceptual systems. This is referring to the basic concepts and foundations of ABA that can help transition from just a technological standpoint to a theory. These are not just a bag of tricks with which professionals use to put out a behavioral fire. SWPBIS focuses more on fundamental concepts such as nurturing and normalization, whereas ABA is a more direct approach. With the nurturing aspect of SWPBIS, sometimes the best evidence-based practices are not always implemented. The effective dimension. The study has a large impact on behavior to be considered of value. A nonverbal client with the capacity to learn 10 signs for manning purposes or 50 commands on a lamp device, which would be more effective for the client. Both ABA and SWPBIS are effective approaches for behavior change. ABA is data-driven and more objective, whereas SWPBIS is a more subjective approach. Generality. Exhibits desired behaviors in multiple scenarios. Ability for clients to generalize and exhibit behavior across environments, people, and circumstances is pivotal. Both ABA and SWPBIS strive to instill generality. Reinforcement-based and manipulation of environment. ABA implements reinforcement, manipulations of stimuli, and contingency control. The above strategies, along with conducting of functional behavior assessments and functional analysis, have aided in the success of ABA. Principles of reinforcement have been a valuable piece to the building and expansion of ABA. Conducting FBAs and FAs will likely increase abilities in several areas, among which are stimulus control and skill development. Efficacy, operant conditioning and range of application. Efficacy associated with ABA has caused a broad expansion from a laboratory setting, which has been largely successful. ABA has founded and been built upon operant conditioning, which has helped drive its success. The range of application has branched out into several environments, such as homes, daycares, communities, and schools. multiple teaching techniques and skill areas. DTT, NET, error correction, errorless learning, chaining, task analysis, fading, and shaping are all teaching techniques found within ABA. Applications of ABA can be beneficial in several areas, such as skill acquisition, social, academic, daily living, independence, and functional play. Service providers and governing body. BCBAs are approved by the Behavior Analytics Certification Board to design implementation plans, conduct FBAs and FAs, and train individuals implementing procedures. BCBAs are responsible for those providing direct care. ABAs and RBTs are responsible for implementing the treatment plan with high fidelity. The BACB is the governing body of ABA, which provides guidelines, ethics, applications, service standards, and compliance codes. SWPBIS equals not ABA. ABA adheres to strict external and internal guidelines, protocols, standards, ethics, trainings. These strict policies are not evident within SWPBIS. SWPBIS has moved far away from operant conditioning, which is a key component of ABA, and has driven its success. Consistency and fidelity in ABA are much higher than in SWPBIS, as ABA staff are all specifically trained in behavior analytics, which is not the case in SWPBIS. Evidence-based practices are a key component of ABA, which is not always found in SWPBIS. SWPBIS does not rely solely on the utilization of EBP as ABA does. ABA is an individualized approach to behavior change, which includes one plan and as a result is very direct and effective for the client. SWPBIS relies on various plans, multiple scenarios, circumstances, individuals with which it is implemented. ABA is geared toward internal validity, whereas SWPBIS is based on ecological, social, and external validities. Clark and Dunlap in 2008 showed that from 1999 to 2005, 63 to 69% of the venues described in the Journal for Positive Behavior Interventions, the main PBS journal, involved typical context for application, while 19 to 24% of the venues described in the Journal for ABA were involved in typical contexts. SWPBIS is concerned with external validity, whereas ABA focuses on internal validity when conducting interventions. This helps to drive the efficacy and fidelity.
So to back up what EJ was just saying, here we see yet another example of SWPBIS. As you can see by some of the descriptions in here, it's much more subjective than ABA is. For example, if you look in the where the block where the responsible row meets learning environments, you'll see be an active listener. You know, SWPBIS doesn't specifically define what exactly that means. That can have many interpretations, and so ABA shoots to more define that in a more objective manner.
I'm going to go ahead and talk some more about the differences between SWPBIS and ABA. As a behavior analysis, we have ethical codes that we have to abide by and make sure that we are upholding to our highest standards. PBIS does not have any ethical codes that they have to follow. They do provide standards, but that they need to follow, but nothing is set in stone. In our case, as behavior analysis, if we are to break any of those guidelines, no matter what level we are at, whether it's RBT, BCBAs, BCBAs, etc., we will lose our license. So for example, code 1.04, integrity, we have to act with integrity or we will lose our license. But for someone that's implementing PBIS, they hope and are supposed to be acting with integrity, but there is no punishment like losing your license if they are not upholding that code. Consistency is a key component of ABA in order for it to be effective. Whether it is being consistent with data collection or implementing a plan, we need to be consistent in order for our treatment to be effective. From personal experience within our group and reading journals about the negative aspects of PBIS, consistency is difficult for our teachers and other staff members at the school to maintain. The reason before this is because the ratios are a lot higher than what it is seen in ABA, so it's hard for teachers to also have to multitask by keeping the data. The issues with these codes are 2.1, documenting professional work, 2.11, records and data, 4.01, conceptual consistency and research, and 9.09, accuracy and use of data. ABA is an intervention that is able to say they are evidence-based. There is a lot of articles discussing PBIS, however, there is not as much evidence behind the interventions as there is ABA. ABA follows their code 1.01, reliance on scientific knowledge with a very high standard, where PBIS does not. ABA also requires that anyone implementing this treatment, they need to be trained and follow the standards of ABA. In order to be board approved, we have to do many hours of hands-on training, as well as lecture training, studying, taking an exam, before we are able to practice ABA. And anyone that teaches ABA to others for trainings or supervisor can only teach within their competency, which follows code 1.02 for boundaries of competence. Once we are board certified to implement ABA, we have to continue our education and stay current on research, assessments, interventions, and much more. And by doing so, we are upholding code 1.03, maintaining competence through professional development. PBIS does not have set trainings that people that are implementing it have to take. They encourage training, but there is no minimum of hours that need to take before implementing the treatment. So for example, it could be your first day as a teacher in the school, and you are already responsible for implementing PBIS with no prior training. SWPBIS is a three-tier intervention plan. Tier 3 is where we would find the individualized plans. As stated by Brown and Michaels in 2006, there is a risk that schools using SWPBS models will begin with their universal approaches and never reach a stage in which all teachers are taught strategies for secondary or third level interventions, which means that no students will have an individualized plan. So what happens to all the behaviorally severe students that need that individualized plan? Ethical Codes 2.09, Treatment and Intervention Efficiency, 4.03, Individualized Behavior Change Programs, and 4.09, Least Restrictive Procedures all ensure that our clients are receiving effective, tailor-made treatment plans and that it is in their least restrictive for that person. PBIS can be effective just like ABA, but overall, PBIS is different than ABA.
All right, I'm going to go over some of the facts that we talked about. PBS, or Positive Behavior Support, is a framework for developing effective interventions and programs for individuals who exhibit challenging behaviors. It uses a wide variety of procedures drawn from applied behavior analysis. PBS also is known for having the framework for a set of values regarding one's quality of life and systematic procedures for problematic behaviors. PBIS is Positive Behavior Intervention and Support and branches further off PBS. It is said to have one of the most effective frameworks for intervention. SWPBIS, or School-Wide Positive Behavior Support, is a systems-wide approach for building the social culture and behavioral supports needed for schools to be effective for all students. This then was built off of the three-tier system. The first tier was universal for all students, the second being for targeted levels, and the third being the most intensive support with the less of the student population. Some frequently asked questions that some may have is, where did SWPBIS come from? It started with IDEA, Individuals with Disabilities Act, and it is based on the principles of applied behavior analysis and the values and prevention approach of positive behavior support. How is it designed to work? It is designed to help prevent chronic behavior problems, provide early intervention, provide proactive supports for children, youth at risk, and provide instruction, practice, and reinforcement for students in various school settings. How long does SWPBIS take to implement? Since it is not a program, the length of time varies between schools. Typically 3 months to a year is to fully implement, but schools have reported noticing an improvement right away. What should be done when the student's behavior is an immediate threat to themselves? When the episodes of behavior are severe, there should be a rapid response to the behavior, and crisis procedures and plans should be in place in advance. When do families become involved in SWPBIS? Recently, family involvement is in all aspects of the three-tier model. However, family involvement is a key factor starting in Tier 2, especially when developing individual behavior support plans. We have a final incoming question. Some argue that positive behavior support is harmful to applied behavior analysis. How would you argue this?
SWPBIS is a large-scale system intervention. It is recognized and accepted, and it has government funding and legislative mandates. Whereas ABA is practice and principles. They have training, degree programs, and certification, and they also have a code of ethics. ABA is more individualized, whereas SWPBIS is more large scale. So ABA can be used in the Tier 3 models, and SWPBIS can be used in Tiers 1 and 2. So for a student who needs more support, he can be referred to ABA professionals such as ABA therapists and BCBAs. And the BCBA can give the kind of instruction and support to the teachers on how to handle more individualized or problematic behaviors. Both can be mutually beneficial to one another. ABA does not have a lot of government funding, whereas SWPBIS does. So SWPBIS is just more accepted because, in essence, you can get the most bang for your buck as the government looks at it. It could be implemented for a large variety of students all at once. So this is where ABA and SWPBIS can work together, because you're always going to have students who need a little bit more help than others, and that's where ABA really comes into play. SWPBIS bridges the inclusion gap from ABA in school settings. So one way to think about this is that SWPBIS and ABA both have the same goals. Both want the student to be as independent as possible, and both want the student to be included in as many different sceneries and different programs as possible. We want to make the students as normal as possible and as included as we can. Some may argue that SWPBIS is ABA for a generalized school setting. For example, a lot of the techniques in ABA, such as pivotal response training, are realizing the importance of stakeholder participation, and they're developing programs such as Project MCAC, which teaches pivotal response training to caretakers and other school professionals in a more generalized manner. So you're using the same principles in ABA, but it's just a little bit more toned down and a little bit more easier to understand. The wording is not as technical. So in closing, I think SWPBIS and ABA can be used together, and SWPBIS is not harmful to ABA. You just have to build on the strengths of each one brings to the table.
So to kind of sum up our debate here, we as a group pretty much collectively agree that ABA and SWPBIS are not one and the same, but are in fact loosely connected. And here we have a Venn diagram comparing the two and showing the differences and similarities between them. So in ABA, we have that it's a more individualized approach to behavior change. It has internal validity to it. There's a higher consistency with the implementation of it. ABA follows strict guidelines in the way of training, protocols, and ethics, and it can be applied across multiple environments. With SWPBIS, it's a more universal approach to behavior change, and it follows a tier-based format, has external validity. The staff aren't necessarily specifically trained in behavior analysis, and it has a lower consistency than ABA does. They are loosely connected though, so they do have some similarities. For example, they both use reinforcement. There's a direct observation of behavior there, and they both rely on data.
And we'd like to thank you for joining us for our presentation today. We are concluding that ABA and school-wide positive behavior intervention supports are loosely connected. On behalf of myself, Jennifer Howe, EJ Ann Sweeney, Kelsey Baxter, Ashley Kaczorski, Megan Pawson, and Zachary Caruso, I thank you for joining us, and we hope that you were able to learn some new information from our presentation today. Thank you.